What is a Christian parent to do when your son tells you that he was born in the wrong body and is actually your daughter? One Christian group of doctors are directly addressing these types of heartbreaking questions, and one of them joins me now. Dr. Quentin Van Meter is here to discuss how parents should deal with gender dysphoria from a clinical perspective. He serves as president of the American College of Pediatricians. Dr. Van Meter, welcome back to Washington Watch.
Glad to be here once again. Thank you.
Now, first, at the highest level, we're talking to parents, we're talking to grandparents, we're talking to families today. We often talk about the political implications of this, but today we're talking about how this works in people's lives. What's the first thing you think families need to know who find themselves dealing with this situation?
Well, for the first thing is to be understanding and compassionate and realize that there is something amiss in this child's life that would lead them to believe that they were somehow born in the wrong body, that they sort of detest who they biologically are trying to avoid being biologically who they are, and that it basically falls on the shoulders of mental health issues and not anything that's predetermined genetically. It is, a mix of environment and circumstances. People in the field of gender affirmation are attempting to find a biologic basis for an incongruence between a biologic sex, which is determined at the moment of fertilization, not just assigned at birth, as they tend to call it, and what is in the environment. And so the idea is that to save this child from suffering, you need to really address those issues, those undercurrent issues, and be careful. And you have a lot of time on your hands to do this. There is always an expressed threat of suicide if you don't rush right in and sort of affirm this child in their incongruent gender. And the answer to that is no, that actually is not the scientific truth. There is no real validity to that. It's used as a sort of a sledgehammer to get things going at warp speed, get the child into a system which is essentially designed to medically and surgically change them for their lifetime and create incredible amounts of medical and emotional morbidity, and unfortunately to mutilate their bodies.
Dr. Van Meter, you refer there to what's happening within the medical profession and what a lot of families encounter when they seek help. And the challenge for parents who are not probably experts on this issue is they have no idea who to turn to. And we hear all these stories about medical professionals who are for personal or professional or perhaps even financial reasons pushing children to transition. What's your advice to a parent who says, hey, I want to be compassionate, I want to be understanding, I want to listen, I want to deal with root causes and try to find out what those are, but I want to do so in an environment where I'm being consulted and my child is being advised by somebody who maybe shares our biblical worldview or is at least not going to rush them into some kind of social and then medical transition as quickly as possible. How does a parent find somebody like that?
Well, we would always invite them to come to the website of the American College of Pediatricians. It's www.capital A, capital C, capital P, EDS, acpeds.org. And that we have a wealth of information in terms of educating the parents, helping them understand. And also we have a network of mental health providers we can regionally get them connected to understand really the basis of what's going on. And I would state that our organization, although many of us, and perhaps the majority of us, are very faith-based individuals, our organization is a strictly secular organization in terms of its welcoming people of all beliefs or no particular religious faith to take good care of children based on the best possible science. And so it's a good place to come because we are really striving so incredibly to avoid sort of the political whims, if you will, of the newness and the current excitement of the transgender affirmation industry.
And you refer to that, well, the excitement of the transgender industry, because it certainly does appear that this has become much more popular in a very quick period of time. How would you encourage parents to interpret that, to understand what is happening culturally that may have caught up their specific child?
Well, we always tend to understand that when we hit on a hot button issue, it's where we get most of the blowback almost instantly from folks who don't really believe the same set of values that we do. And that is the internet is really responsible for the access of these kids to information that their parents are really not necessarily aware of. Information that is essentially dangerous and brings these kids into a world, almost a cult-like world of an affirmation of their wonderfulness only if they accept the fact they're born in the wrong body. So kids are very vulnerable in their young teen years, and this is a particular recent situation where adolescents who'd had absolutely no expression of any dissatisfaction with the sex they were born in terms of playing the social roles from the spectrum of one end to the other, effeminate to masculine. They knew who they were biologically, and that's kind of how they lived and how they thrived. But now there is this sense of born in the wrong body. This is a wonderful opportunity for you to shed all of your angst, if you will, of growing up through puberty, and join a group where people will just love you because you're new and special, and you can come and you can jettison your biologic family. They're no good. They don't want to support you. They're your enemy, but we're your friend. And so that to a troubled teenager who is, what teenager has not been troubled during the progress through puberty? It's a rarity to find a child who comes through that unscathed. You give them an opportunity for this false sense of relief and happiness in this new, what we call glitter world, if you will. Jettison your family, come join ours online. We'll love you unconditionally. Your parents are mean and not supportive. We are very supportive. Come here and be happy. And that invites these poor vulnerable kids into an environment which is very, very dangerous for them.
And it's not just their peers or the community they develop online that will tell them this. In many cases, it is now their teachers, their counselors at school, and in many cases, their doctors as well. We were, before the break, discussing the various influences that have led to the social contagion that we're seeing. You mentioned the online communities that young people are finding that you think is a significant contributor to this situation. What's the right way for parents to respond to this situation? And should they just cut off internet access to stop that from happening? Because this is a challenge even for everybody who has a teenager is dealing with challenges of technology and access to the internet. What do you recommend for parents in that situation?
Well, I would say the parents should monitor what's going on with the internet with their children. I think that makes a lot of sense. There's not really a reason why a child has to have access to the internet in their bedroom, their private space, 24/7. There needs to be a monitoring of what's going on, and perhaps a cutting off. I know some parents say, "Hey, it's 10 p.m. on a school night. Give me your devices. And we're going to shut down the internet so you don't have access to it." That's not mean and mean-spirited. That's actually a pretty good way to handle that. I think proactively, if the parents know what the issues are, what the kids may be facing, and the transgender issue has come up so much in their face, that they should have a sort of a proactive discussion saying, "Hey, we've never discussed this, but I just kind of wanted to know how you feel about it," and say that to your child and say, could we talk about it? I want to be open about it. If you have any concerns about, your friends or perhaps a personal experience that you just aren't willing to necessarily share, we want to be open about sharing it with you so that, we go through things together as a family. We're your support group. We love you unconditionally. Yeah. We disagree. We have rules. You may not like them, but, let's make sure that this does not happen in the background for lack of paying attention.
And I'll say in our house, at least, the devices are gone long before 10 o'clock at night, Dr. Van Meter. But I think some boundaries are certainly appropriate. Now, you hinted at some of these, but I'll ask the question very directly. What is the wrong way for a parent to respond in this situation? Undoubtedly very emotional, perhaps very surprised. They hear this news from their child. What's the wrong way to respond?
I think if you isolate the child from everybody they know and say you can't go out at all, you're going to be imprisoned under my watchful eye so that I can essentially control everything you do. That's a really bad message to give the kid, especially the adolescent child, in the midst of their wanting to gain some autonomy and sort of discover things. It's just, I think to be angry, to be punitive, to discipline them physically, to threaten them with harm in any way is absolutely the wrong way to go. These kids literally are crying out for help. This is a cry for help. This is saying, I am in such deep anguish and depression and anxiety. I don't know where to go, and I'm trying to go someplace, and the transgender thing seemed to be the right place. I think they just need to discover, and this is an issue where families can be dysfunctional, and often are, and they're sort of essentially a part of the problem. And I think the parent needs to say, I'm not a perfect parent. I may have sent my child toward this rabbit hole by things that I have unwittingly done or didn't mean to do in any harmful way. But I may be part of the problem, and I think I need to be open to the fact that I need to accept any role I have had in this child's anxiety and depression and unsettled sense of self. And so they should say, I would like to seek help, and I would like to seek help for you, and we need to do this together because we are a family, and we will cherish each other from our first breath until our last. And I do not want to see harm come to you.
Dr. Van Meter, you are the president of the American College of Pediatrics. There is another American Academy of Pediatricians, and they have a very different perspective than you do on this issue. Parents who are looking for help will undoubtedly find very different perspectives. How do you, as a clinician, as someone who cares about young people, explain why parents will find such different advice when it comes to how they handle the situation?
Well, the American Academy of Pediatrics has essentially turned into sort of a political advocacy group. Yes, they do maintain a lot of wonderful educational stuff for the pediatricians. They do come out with some general policies about wellness for children and whatnot, but they have been threaded with a lot of political beliefs and lean toward not so much the family, but just the kid is an autonomy individual who really doesn't necessarily need the parents. The whole adolescent secrecy situation where don't share anything with your parents that you don't want to. You don't have to do that. They're the bad actors in the first place. That's the attitude that comes across. And it's doing more harm than it is good. The American Academy of Pediatrics was not built to essentially become a completely political organization, but it really has morphed into that over the past 30 years. And that's the sad thing. There's stuff that is basically for the benefit of adults at the expense of children.
Dr. Quentin Van Meter, president of the American College of Pediatrics, thanks so much for your time.
Glad to be here. Thanks for having me.